So what do we know about the effects of green tea on our health? And also, how long should we be taking it for? I'm really starting to look at the pros and cons of the long-term use of green tea. There's been several documentations of people overdosing on green tea, which it can do. I did a lecture back in March, and one of the things that I spoke about was I think that with taking 4 or 5 cups of green tea that's recommended for patients of breast cancer, prostate cancer, while they're going through chemotherapy, and they did it for 6 or 8 weeks, and the results were very, very good and very, very favourable. However, I think that taking it for a long period of time, 3, 4, 5, 6 months, may have some health implications all on their own that are contraindicative to the data that's out there. So I'm going to be looking at the build-up of the properties of all teas, but specifically green tea in the liver, and whether one should be taking it 5 days a week, having 2 days off, and maybe just taking it for 6 weeks and then having another 6 weeks off. They're the kind of things I'm going to be looking at. Pregnant women definitely should not be drinking green tea. People also who are on blood thinners, warfarin, etc. also shouldn't be taking green tea in any amounts due to vitamin K. And obviously vitamin K itself is in tea leaves as a whole, as a default. So I'm not sure where that fits in, but obviously it's a lot more potent because of the lack of processing of green tea leaves. And I've also spoken about the sources of green tea, how it's affected by pesticides, herbicides, the nitrogen cycle, all those kind of things I'm going to be talking about. But don't worry, I'm not going to bore you with it with lengthy videos. It will be available to purchase as a DVD and a PDF should anyone be interested for their health or people they know who would be interested. So keep looking. Thank you.